Hi, I just wanted to record this video so I could update you about my recent hospitalizations and recovery, and to thank you profusely for your thoughts and prayers. On January 25th, I reported to urgent care at the local VA hospital for a colon problem. I hadn't been able to take a normal bowel movement for a week, and all that was coming out was clear liquid, which was most unusual. I was also feeling discomfort in my abdomen. The physician on duty ordered an abdominal x-ray and diagnosed a bowel obstruction in my sigmoid colon. I was immediately sent via ambulance to a local area hospital and admitted for a life-threatening condition. As you probably know, the colon consists of the ascending, transverse, and descending colon. A colonoscopy is used to examine the entire colon, whereas a sigmoidoscopy or flexible sigmoidoscopy is used to examine the last third of the colon, which is the descending colon, also known as the sigmoid colon. It's connected to the anus by the rectum. Most of you over 50 have probably had a colonoscopy like me. When I was admitted to the hospital, a gastroenterologist performed emergency sigmoidoscopy and diagnosed my condition as a twisted sigmoid colon. He was able to successfully straighten out the kink and decompress the bowel, which removed the risk temporarily until surgery could be scheduled to prevent the twisting, because it can retwist. In case you hadn't guessed, the bowel is just another term for the intestines. Small bowel refers to the small intestine, and the large bowel refers to the colon or large intestine. The doctor said I was born with a sigmoid colon redundancy, which simply means excess colon. It is not unusual in itself, but can cause an increased risk for a condition called sigmoid volvulus, primarily for men in their 60s. Volvulus results when the sigmoid colon becomes knotted by wrapping around itself, which can be a life-threatening condition, except that this was caught early in my case with no further complications, which could include choking off of the blood supply and necrotic or dead tissue. On January 28th, after several days of bowel prep, which involved clear liquids and drinking Go Lightly to clean out my colon, the surgical team removed the excess colon so that it will not get tangled or kinked up in my interior, and my interior plumbing will work much more efficiently. I remained in the hospital about a week and then went home with certain restrictions. Special diet, rest, and no lifting over 10 pounds. Once my large intestine was cleaned up or closed up for healing, an ileostomy was performed, which pulled the end part of my small bowel or small intestine through an incision in my abdomen to form a stoma. Unlike a colostomy, which is an opening in the abdominal wall to bypass the large intestine, an ileostomy is an opening at the end of the small intestine to allow waste to move out of the body into a pouch while my colon is closed off for healing for 2 months. I learned how to perform ileostomy care, needless to say, for the next several months and change the ostomy pouch every 4 or 5 days. I had an ileostomy bag, which kept me from sleeping well at night because I had to get up every couple hours to drain it. It was a bit humbling and inconvenient, but became routine over time. My wife Joy deserves a lot of credit during this time with her background as a dietitian and nutritionist. She made sure that I stuck to a low-density diet. I was scheduled for ileostomy reversal and colon reactivation surgery on March 18th, almost 2 months after my initial surgery on January 25th. But unfortunately, the day I was supposed to have surgery, the hospital was shut down indefinitely for all non-elective surgery for coronavirus preparedness. Much to my disappointment, my surgery was delayed and I had to continue with ileostomy care for 2 more months. I should not have complained, I guess, since some people have to do it for life. As the curve began to flatten with the COVID-19 epidemic, hospitals began to reopen for non-elective surgery, and I was one of the first ones scheduled for surgery on May 21st. I was looking forward to the surgery and getting my colon back to normal, but was unprepared for the shocking turn of events that occurred. I reported to the hospital on 10:45 p.m. Thursday, May 21st. My abdomen was closed and reconnected to my ileostomy was closed and reconnected to my colon. Everything went as planned. After surgery was completed, I was transported from recovery to the patient ward. On Friday morning, I woke up, passed a bunch of gas and diarrhea, so I thought. And the nurse came and said it was all blood. I sat up on the edge of the bed, and nurses cleaned up the bed. I felt horrible, and something seemed to be going drastically wrong with my recovery. I was sent for a chest x-ray where I made a bloody diarrhea mess on the wheelchair and could barely stand up for the x-ray. I felt like I was having an adrenal crisis and requested a cortisone shot for my pulse was 150. I was breathing heavily, felt like I was going to pass out, and my blood pressure crashed. After I coded, medical staff intubated me and put me on a ventilator with fentanyl and propofol to sedate me and keep me stabilized. An emergency colonoscopy was performed on Friday night at 6:30 where rampant C. diff infection was observed in my colon. Where did the C. diff infection come from? It was not my colon, in my colon for the 4 months it was closed off. The suspicion was that I got it in the hospital when I came in for surgery on this visit. I was diagnosed with fulminant C. diff colitis, which can have serious systemic toxic effects and shock, often resulting in colectomy, which is removal of the colon, and death because it has a higher mortality rate. This is not what I came to the hospital for. On Friday night, I had a second surgery. The surgeon reopened my belly to recheck the colon and perform colonic lavage, which is hydrotherapy to cleanse the colon, try to remove the C. diff infection. Rectal tube was inserted at that time to start vancomycin antibiotic enema infusion. Fortunately, my colon was observed not to be ischemic, so no damage due to restricted blood flow or oxygenation, lack thereof, to the cells. There were no perforations observed in my colon, and it was a 50-50 chance whether I'd have to have a colectomy removal. I was moved to ICU late Friday night. Doctor gave permission for Joy to visit at 11 p.m. because there was no visitation due to coronavirus. I had a severe C. diff infection. That's when the doctor told my wife. My belly was left open until the next day. The typical protocol for a fulminant C. diff infection is intravenous fidaxal, which is metronidazole, and also vancomycin retention enemas every 6 hours, and oral vancomycin as well. Joy gave verbal consent on Sunday morning for a third surgery. Surgeon again washed out my belly, checked the colon one more time, and attached and stitched my belly closed for the last time. The doctor observed ulcerations due to C. diff, but no perforations in the colon, thank God, which would have probably implicated a colectomy would be required. Thankfully, I did not lose my colon, particularly after the original surgery that was done to repair it. I came off the ventilator Sunday afternoon with a continued stay in ICU to treat septic shock. Fentanyl and propofol were discontinued when I came off the ventilator. Septic shock is a life-threatening condition in itself, accompanied by low blood pressure and organ failure caused by severe or localized system-wide infection, and requires immediate attention. Fortunately, I had no organ failure. The C. diff infection began to stabilize, and I received focused antibiotic therapy for 10 days in the hospital to receive the proper protocol for C. diff antibiotics. A PICC line was installed in my arm to effectively deliver antibiotics and total parenteral nutrition. I was given ice chips only and no other food or water for 10 days, which was excruciating, even though my mouth was dry, my lips were peeling. But of course I was getting nourishment through my IV antibiotics and also oral vancomycin every 6 hours, along with the vancomycin enemas and the metronidazole. It just seemed like hours, minutes turned into hours, hours turned into days. It just, time went by so slowly, so I thank you so much for your prayers and thoughts and my faith, which all helped to sustain me during this time. And thank God I had a smartphone and I could communicate with Joy periodically through video, FaceTime, and email, text, and that allowed me to keep in touch with the world. It wasn't until a week later on May 30th that the doctor called my wife and told her the good news that my colon survived based on the white blood cell count measurements that were improving, indicating that the C Diff infection was being reduced. I started taking probiotic supplements by mouth, Florinex, which is Lactobacillus acidophilus, Saccharomyces boulardii, and these probiotics help prevent a recurrence of C. diff infection, which there's a 20% chance it could recur. After my healing progressed, my tubes were removed, such as the oxygen in my nose, the nasogastric tube, rectal tube, JP, abdominal drain tube, and also the intravenous lines were removed, and I was discharged on Tuesday, June 3rd, finally. And then a week later, yesterday, I had my staples removed from my abdomen. And so I'm gaining strength every day. Thank you for thinking of me. It really helped me to survive for 2 weeks in the hospital. And I'll be making more videos about my experiences with C. diff and on my YouTube channel at Larrycdiff. Larrycdiff. Thank you so much for